Welcome to episode 24 of Beyond the Thyroid. I am so happy to have you here. So today I've got another wonderful, exciting guest episode for you, and I'm happy to see you here because we are going to talk about a powerful step that we can all take towards better health, and that is movement. So today I have with me on the podcast Dr. Sara Ionescu. She is a board-certified family medicine physician, mom of 4, soon to be 5, wife, and exercise enthusiast. She is passionate about wellness, preventive care, and the life-changing benefits of daily movement. She knows firsthand how transformative, simple, consistent exercise can be, not just for physical health, but for mental and emotional well-being too. So in this episode, we are going to explore how even tiny amounts of movement, like a few minutes of stretching or walking, can create profound changes in mood, energy, and hormone balance. Dr. Ionescu shares practical, approachable tips for anyone, whether you're completely new to exercise or in the postpartum period, or just struggling to find time to move. So if you have been waiting for the perfect time to start exercising, Dr. Ionescu's message is clear. There is no perfect time. There's just today, and one small step can set you on the path to lasting health. So let's dive in. You're listening to the Beyond the Thyroid podcast. I'm your host, Dr. Dana Gibbs. I'm an ENT surgeon and hormone specialist. For years, I struggled with my own unrecognized thyroid problems before and even after I was regularly performing thyroid surgeries. Then, one day, I learned something that turned my health around and opened my eyes to the limits of mainstream medicine in treating more subtle thyroid abnormalities. I spent the next 20 years fine-tuning my hormone expertise in disorders like Hashimoto's disease, perimenopause, and stress-related illness. Come join me as I share this new approach to hormones that empowers you to take control of your own thyroid and hormone imbalances. Let's dive in. I have a really exciting announcement. Because up to 50% of people who suffer symptoms of low thyroid, the low energy, the weight gain, the gut problems, the thin hair, dry skin, will be told by multiple providers that there's nothing wrong with their thyroid before they get a diagnosis because they have normal TSH, I am going to build a new offering in my practice that I'm going to call the Thyroid Checkup. Because this circumstance is so discouraging and frustrating when you know you don't feel like your normal self. I know because it happened to me and hundreds of my clients. So if that's you, what you need is access to advanced thyroid lab testing and analysis by an experienced and qualified specialist who goes beyond guidelines-based thyroid care to help you finally know where you actually stand in regards to your thyroid. This will be a small group program with direct access to me, where I'll help each person get answers about their thyroid status and next steps to recover their energy and vitality. So if you want more info about this, go to www.danagibbsmd.com/checkup to get the earliest notification when I open this program. It's going to be soon, so don't wait. All right. So, Sara Ionescu, it's so exciting to have you on the podcast today. Welcome to Beyond the Thyroid.
Thank you so much.
And why don't you introduce yourself to the audience?
Sure. So my name is Dr. Sara Ionescu. I am a family physician. I'm a wife, a mom of 4, and an exercise enthusiast. And I am currently creating exercise content online on YouTube and various social media platforms. I am somebody that wants to inspire others to be able to move in a simple and consistent way that allows them to see wins in their physical and mental health. So that's me. That's where I'm at right now.
All right. That is so cool and awesome. Tell me a little bit about your background.
Sure. So I grew up as a competitive athlete. I was a swimmer from the age
Mm,
of 5, and I swam all the way through college.
okay.
And then when I graduated from college, I came to this point in my life where I really wanted to exercise consistently because that's what I had done, but I could not figure out how to do that. And in hindsight, in looking at some of that, a lot of it had to do with always having a coach that, prescribed the workout, and we had a set schedule, and here's what you do. And you just kind of showed up, and there wasn't a ton of thinking about it. You just showed up, you did what you were supposed to do, you worked hard, and then you left. And so when I transitioned to being an adult, I found, a struggle there with how to do it on my own. Eventually I found running, and so I figured that out, got into that. Then I get into med school, get married, start having babies, and throw in all these other factors that now I was struggling again with how to fit it in and how to make it consistent. And for me, a lot of it was the definition of exercise. So, as somebody that was an athlete that was exercising vigorously, sometimes multiple hours a day, then I found that when I could not meet that definition, I just did nothing because it felt like it wasn't worth it or I wasn't meeting the criteria. So, why bother? And I just didn't do anything. So
Mm,
I had a long period of time where I had a hard time figuring out how to do it. And then I realized one day when I was in a patient room talking to a patient, telling them what I told all my patients, which was how important movement is. And, they said, Doc, it's just so challenging. I can't find the time. And I said, well, do you have 1 minute a day to move? And inevitably, people would always say yes, because how could you say no to that? And so they would say yes, and they would get started. And in my head, when I was telling this to a patient one day, I thought, why am I not listening to this advice? Like, I'm at home not doing much, and I'm giving this advice out. Like, I should be listening to this because clearly I can't figure out how to meet the definition that I had before. So maybe I should just meet myself where I am and start somewhere. And over the years, that was when I was postpartum with my first daughter. And so over the years, I have become more and more consistent despite having more kids and seemingly being more busy. And so when I started to think about getting on social media and what I have that may be helpful to share, I thought this is something that people that are busy, everybody feels busy and they wonder how they can. And I thought I figured out some of these things along the way, like maybe some of this would be helpful to share. And so that's
absolutely.
ultimately what got me inspired to do social media.
Okay, that's that's very cool. So, a lot of my patients have hormone issues, hormone imbalances that really sap their energy, and when they overexert themselves, it really makes that problem even worse. And so, one of the things that we in my practice is Hashimoto's disease, and the time when
Hmm.
that typically shows up for a lot of women is in the postpartum period. And so I want to talk about exercise from the viewpoint of the person who might have never been someone who was an athlete, who might never have done regular exercise. And tell me some about what you see as the benefits of exercising either while you're pregnant or after you're pregnant, and specifically in regards to how it helps your mood and your energy levels and that sort of thing.
Absolutely. So I think that, everybody always thinks about the benefit, the physical benefits of exercise. And so, when you're pregnant, it's so important to be physically active for multiple reasons. It maintains your physical health, it helps the health of the baby. It can also allow for a smoother, easier delivery in general, because the more, aerobically fit you are, that process can be easier. But
Mm.
I think the often overlooked benefits of exercise, both prenatally and postpartum, is the mental health aspect, because I think that, especially when pregnant, there's all these things happening, right? Your body's changing, you're growing a human, your hormones are all over the place. And physical activity can really help, I think, ground you. And I will say, with my first pregnancy, I was, previously had sorted out that physical activity and I was able to maintain that. And with my second pregnancy, because I had a toddler, I really struggled with incorporating that. And I
Mm.
noticed a significant difference in how I felt, especially towards delivery. Like, the bigger you get, when I was more active, it was so much easier to feel comfortable, to get comfortable. I was sleeping better. And when I wasn't as active, I had more issues with those sorts of things, like the aches and pains and the
Mm.
swelling and just the things that come on with being later in pregnancy. I also think that, pregnancy and postpartum can be a really challenging time because of the hormone fluctuations. And for me, exercise in the postpartum period really helped me maintain a stable mental health situation. And
Mm.
so, even if it was only a minute or two and I did that a few times a day, like, that made a difference, because my first child, I really was not active until I was probably, like, consistently active until I was close to 4 months postpartum. And with my second and then third and fourth, I was active much sooner. Like, basically, as soon as I was cleared to do anything physically active, I was out there doing just a few minutes at a time. But
Got it.
it at first, it sort of felt like, oh, it's nothing. Like, a minute means nothing. But it absolutely made a difference, because I saw, on days where I didn't do it for whatever reason, and that was okay. I gave myself grace. I have a newborn, I have toddlers, also all of this stuff. But on days where I couldn't fit it in at all, I noticed at the end of the day, I was more quick to be, like, upset about things. I was getting more frustrated much more easily. Just like my tolerance for everyday things was significantly less. And so I knew, for
Wow.
me, even finding a minute or two was absolutely worth it. And of course, like, when you have a newborn, I mean, you may only have that minute or two. And what I started
Right.
to realize, the more kids I had, with my fourth baby, like, if I had 3 minutes left of a workout and he started crying, like, it's okay. He can cry for the 2 minutes, and I can, you start to realize, like, they're going to be okay. Of course, you're not neglecting them, but you also have to make sure that you are doing what you need to do to take care of yourself, to be able to take care of everybody else.
Right. Yeah. No, that's so important. And I'll tell you, 2 or 3 minutes of crying can seem like a lifetime when you're sitting
Yes,
there listening to it,
yes.
trying to do something else. But yeah, I see your point there. That's really fascinating. So, what kinds of exercise would and I'm assuming that, some of my people are experienced with exercise. They're either runners or cyclists, or, they have a Peloton and they get on there and go, or something like that. So I contrast that to, what would somebody do if they have never been one to exercise before and they're like, oh, that's just not me. But they want these benefits that you're talking about, the mental health grounding, the physical comfort, all that stuff. What would you suggest for those folks?
Yeah. So I think, I mean, and I think some of this would be, applied to a postpartum person, but really it can apply to anyone that's new to exercise, because honestly, a postpartum person is getting readjusted to their body and readjusted to life. And so I think that this really applies to anyone that's brand new to exercise. I think that stretching, so just some gentle, regular stretching, which, there are loads of resources out there that are really helpful. But I find that a few minutes a day of stretching, it gives you time for your brain to have a break to sort of reset, but it also, provides flexibility and mobility to your joints, to your muscles, which can help with, stiffness and aches and pains that a lot of people have when they are not moving regularly and then they start to move. And I think that some of this stuff can be less daunting because it's not like you need all kinds of fancy equipment. You have to pay for a gym membership. I mean, if you have an internet connection, you can get on to YouTube or other, there are a lot of credible, exercise type free resources where you can get some ideas for how to stretch and what to do safely. Another really super simple but incredibly beneficial thing is just walking. And it doesn't have to be like I'm drenched in sweat, I'm almost running around the block. If you are somebody that's not active really in any way, just getting up and walking, even if it's just around your house, you don't even have to go outside if it's raining or whatever. Like you just getting up, that's what I would have patients start with. People that were not moving regularly, just get up, walk around your couch for a minute. If you have stairs and you can safely navigate them, go up and down for a minute. And then you can slowly, incrementally progress that where maybe you're doing it for 2 minutes or maybe you're doing it for 2 or 3 times a day. But as you start to move more, you'll start to see those benefits, and then it helps you create momentum because as you see benefits, it's like, oh boy, this is happening because I'm doing this, and now I want to keep going because I'm seeing good things happen.
Right. Oh, no, that's really exciting. Okay, so just stretching, just walking. And what do you notice as hormonal benefits of those incremental things?
Yeah, so I really think any movement, whether it's walking, stretching, I, as a pregnant postpartum person, did a lot of, and even as somebody with chronic back pain, did a lot of deep core work. So, like the innermost layer of your ab muscles. I have found that no matter which of those activities I'm doing, I also do other things now, run, cycle, all of that. Like no matter what movement it is, I feel more stable, like mentally, physically, hormonally. It just
Got it.
somehow helps process things in your body when you move more. And so that's just what I've found, personally for me, but then also with some of my patients that, have had some issues where we had tried or other doctors had tried various different medications. And it was like, this is just not working. And it was like, well, are you moving? Like, do you no, I don't do anything at all. Well, how about you do this? And people would come back and say, like, I mean, I've had menopausal patients come back and say, my hot flashes are better, my fatigue is better because I started moving. They may not be gone completely, but they did see improvement when they started moving themselves.
Right. And I'm sure that's true in the postpartum period as well.
Yeah.
Okay. So when you say deep core work, I'm assuming that walking is not enough for deep core work. So give me some examples of deep core work for somebody who's not necessarily an experienced at exercise kind of person.
Sure. So especially in the pregnant postpartum person and people with things like low back pain, like I said, that deep core, which is basically, let me adjust it's like the corset muscle that, it starts at where your diaphragm is, which is your breathing muscle, and then it goes down to your pelvic floor. And it's basically shaped like a canister. So it has, there's muscles this way, but then it wraps. So it's like a corset. The most basic, most fundamental exercise for that is called 360-degree breathing. So truly, you do not have to be an exerciser. I mean, we all breathe, obviously. So it's really just focusing on an intentional type of breathing. And the way that you do that is you put your hands around your rib cage. So you have your 4 fingers wrapped around the front of your rib cage and your thumbs around the back. And you take a deep inhale in. And when you do that, you should feel your ribs expand into your hands, but they expand in 360 degrees. So they're expanding forward, sideways, and backwards. And then when you exhale, it's not a typical exhale. It's an exhale like you'd be blowing out like 100 birthday candles. And when you do that exhale, you should feel like there's a corset around your belly that's sort of tightening up, and you want to feel your pelvic floor sort of contracting up and inside. So that exhale, where you feel that corset tightening with that forceful exhale, is engaging that deep core layer of abs. And
okay.
So if you've never
I'm
done
sitting
it
here
before,
trying to
like
practice it and see if it works.
Yeah.
So,
ahead. Ready?
so it's
let's
like
inhale.
you band everything and then
Expand
you just blow out
all
as hard and
directions.
as fast as you can.
Not necessarily as fast, but as
Okay.
like forcefully, like you're blowing out birthday candles. So you kind of do an inhale, and then the exhale is.
Okay.
And like I said, the important part with that exhale is that you feel that corset tightening around your belly, which indicates that you're contracting that innermost layer of ab muscles.
Okay.
And I will say I started doing this after my second pregnancy, and it took me really weeks of practicing it to really like get it and feel like I was actually doing it correctly. But the more I practiced, the more I figured it out. And again, like I noticed it helped with back pain. So I noticed improvement with back pain, with just recovery from pregnancy. It can help if you're somebody that has a separation of your abdominal muscles, it helps bring that together. And the idea with it is once you get it down, you can use this breathing also, like if you're lifting weights. This is something like when you, on the hard part of the weight movement, when you're doing the exertion, you do that forceful exhalation, and it can add the benefit of you're also working your deep core while you're doing whatever strength training move you're doing.
Okay, that's very interesting.
Yeah. The last thing I'll say about that is it is also incredibly helpful for like moments of stress or anxiety or panic over whatever it is, like whatever comes up during the day. Taking a couple minutes to do a few breaths like that, it calms your nervous system down. And so even if you feel like you can't get control of your brain, doing that breathing helps your nervous system calm down, which then can leads to your brain being able to calm down. So I also found it super useful for that when kids are having tantrums and crying and that sort of stuff. Like I would take a minute and do this breathing, and it would help calm things down.
Yeah, and is this kind of the thing where you would just say, okay, I'm going to just do five of these deep breaths, or
yeah,
okay, now
and
I'm calm, now I can go, take they take the toy away from the child that just took the toy away from the other child.
Exactly. I think, and then in the postpartum period, or for people that want to work on deep core, there's a whole bunch more exercises you can add on. Mm-hmm. But I think that one in and of itself is very effective, and it's very simple, right? So I think it's a less daunting thing to start with because it's so simple, because it's just breathing. It's just thinking about your breathing.
Yeah, no, that's very cool. So, and you mentioned back pain, and you mentioned diastasis, and lifting heavy, like overload strength training, is something that I push people to do. And so I wondered how you think about more kinds of exercise that help people with low back pain, because I'll say my personal experience with low back pain, and I had some kind of disc capsule tear or something like that. I don't know. And the doctor I went to wanted me to get injections and all this stuff. And I said, I'm going to try some exercise first. And I went and started doing strength training. And, part of that is squats and part of it is deadlifts and other things. And I found very quickly, even, and I started lifting nothing basically because I'd never done it before. And I found that very quickly back pain started to clear up and go away. And so I was not in the postpartum period, of course, at that point, but I'm just curious how you feel about strength training for people in pregnancy and postpartum. Is there limits that ought to be set on that? Is there time frequency? Is there rep frequency limits that ought to be put just to be safe, just to keep your safety?
Yeah. So I think that I think you're absolutely right. I mean, I personally also saw benefit with strength training to help my back pain, and I've also seen it with various patients. I think that strength training is hugely important for everyone because it helps with longevity and it helps with your functionality as you get older, because we know how important it is to do a little bit of strength training. And it doesn't have to be, it can be lifting heavy weights, but it can also be body weight. If you have not done it before, your body can be your weight, and that still counts as strength training. I think in the prenatal and postpartum period, I think that it is absolutely important and something that I always try to incorporate because, again, I think it helps with the delivery process. It helps with recovery afterwards. Like your recovery through the postpartum period is much more efficient and quick, really, than if you did not maintain your muscular strength. I think, and I would have to double check, but I know most recently what I read about pregnancy and postpartum, years and years ago, it used to be based on heart rate. So you only wanted your heart rate to go up a certain amount. Now we've kind of moved more towards what's called the rate of perceived exertion, which basically means when you are exercising, how much do you perceive that you're exerting? So basically the scale, is 1 to 10. 1 is you're sitting on the couch watching TV, and 10 is, you're full out sprinting, can barely get a word out because you're so short of breath. So, obviously the scale is big, but the rate of perceived exertion, it sort of depends on if you were somebody that was exercising before you got pregnant or not. How high you get on that scale is different. And if you talk to different doctors, it can be different. But typically, like if you were exercising regularly before, like it's safe to get to a 7 to an 8 on that scale. If you were not exercising before, it's probably more like a 5 to a 6. But in terms of so that's the idea, is when you are doing those things, strength training during pregnancy, you just want to keep that in mind. Like, how much am I exerting myself? Can I talk through this? If you're getting to a point where your sentences are getting choppy, you may be at that limit of, I really don't want to go anymore. And of course, if you're having pain, if you're feeling lightheaded or dizzy, this is like, no
That's
way,
too much,
stop,
yeah.
talk to your doctor.
Sure.
Right. And
Yeah.
I would recommend any person, talk with, because obviously this is for somebody that's having a totally normal, healthy pregnancy. And so you definitely have to talk to your doctor to get customized advice. The one thing I will say in terms of movements that you can and cannot safely do, I think the biggest thing in pregnancy is to avoid things like planks, unassisted planks, and unassisted crunches, because when you're doing those specific moves, planks and crunches, that can really increase the risk that you're going to pull apart those abdominal muscles, where you increase the risk for what we call the diastasis. And
Sure.
on the flip side, when you're postpartum, until everything is fully healed, whether you have a diastasis, that separation or not, you really want to avoid doing planks and crunches until that is fully healed and your abs are back to normal. Because doing those increases the intra-abdominal pressure, which can push it apart again.
Can push it apart. Yeah, I'm trying to remember. So that injury that I described that I had actually occurred while I was pregnant because I went to pick up
Okay.
a chair and I wasn't ready for how heavy the chair actually was. And I guess your ligaments kind of just get a little lax while you're pregnant. I
Yes.
guess that's part of the high
Yes.
progesterone. And I picked up that chair and I felt something and it was immediate and it was, severe pain. And years later I was still struggling with it. And if you're going to plan an exercise program for someone who's pregnancy or early postpartum, I guess the kind of, I don't know what the right word would be, but the idea is incremental and don't overdo it.
Right.
Yeah, because
Yep.
lifting up that thing that, and I don't even know how heavy it was, but it was just heavier than I thought it was going to be. So I wasn't ready. And it was just immediate. Boom. Ah,
Sure. Right.
but,
And when you're pregnant, your abs are not as strong as they typically are. So then that affects your back also because it's so important to your spine health to have, strong, deep core.
okay. Yeah. So cool. So good. So, do you have some particular online resources that you tend to recommend? And then I'm going to ask you, of course, where people can find you as well.
Sure. So I do not specifically. I hope to create my own at some point, but I don't have
Awesome.
anything yet. But I actually do a lot of Peloton, and a lot of what
Mm-hmm.
I learned about postpartum is from that platform. Now,
Mm-hmm.
obviously, there's an investment there. There's a monthly investment. You don't have to have the equipment. You can just, have the app and get access to those classes. But really, so when I was postpartum with my second, I got referred to a physical therapist because of pelvic floor issues. And so
Mm-hmm.
that was hugely helpful because they gave me loads of handouts of exercises to do. So I think always looking into, a physical therapist with that sort of stuff can be helpful. I really, I often would just get on YouTube and look for people that were credible. They were trained, whether it be, a physician or a physical therapist that's trained in pelvic floor or exercise, those types of things. And I would say, I would always ask your doctor because they may have resources that they use. When I was practicing, we had resources as an organization that we were able to print out and give patients for free. That was just part of our electronic medical record. And so that's
Sure.
another great resource because you're getting legitimate resources there. I just would recommend people be careful if you're just searching for things online because really anybody can put anything online. So if you are doing that, you want to just look at who's created it and see what their background is and what their training is and make sure that they've had some sort of training in what they're telling you about.
Sure, absolutely. All right. So if people want to find you, how do they find you? What's your best
Sure.
way?
So I probably my best way where you can start to see, more of what I talk about is on YouTube. So my
Mm.
YouTube handle is Dr. Sara Ionescu. So it's just DrSaraIonescu. And I'm there every day. I do like a little short, which is a quick little tip. And then I also have some weekly videos that are longer form. And then I am also same handle on Instagram and Facebook. And then I also have a website where
Mm.
people can go to sign up for my free newsletter, which, like I said, in the future, I plan to have more about actual exercises to do and tips and tricks. So that website, same thing, DrSaraIonescu.com.
Well, this has been so fun and enlightening and interesting. And is there anything else before we sign off? Is there anything else in particular that you would like folks to know about what you propose and what you like for folks to do?
I think, Dana, really the biggest thing is to just get started. So I think for so long I sat in inaction, waiting for the right time, like waiting for it to be the perfect time and for me to have the perfect plan and for everything to be perfect. And what I realized is that will never happen. And that's why I wasn't doing anything, because it doesn't, like, that will never exist. So it's about just
Yes.
doing, right? Like, I mean, truly, it really won't. And so,
Totally true. Totally true.
yeah. And so I think that just taking any action, as imperfect, as messy, as like awful as it feels, once you start doing it and you do it little by little, it builds momentum. And then when you get that momentum going, then you can expand and you can, make it bigger. But I think it's not about motivation. It's about this little sliver to get going. Just do it that one day. It's not perfect. It's messy, but then just keep going. Baby steps, one foot in front of the other, and then you build that consistency. So I think that's what I would say. It doesn't have to be perfect. It's going to feel yucky. It's going to feel messy, but it's okay. Just do it for yourself.
All right. Very good. Thank you so much for coming on. This has been wonderful. And I can't wait to talk to you again soon. But that's all the time we've got for
Absolutely.
today. And so this is Dr. Gibbs signing off. Y'all take care.
Yeah, thank you so much.
It's been
Bye.
fun. Bye. Thank you for listening to this episode of Beyond the Thyroid. If you found this information valuable, it would mean so much to me if you'll take a few seconds and give the podcast a 5-star review. It helps other people who need this information find the show, and it's really easy. Just search and click on the name of the show, Beyond the Thyroid, and scroll to the bottom to ratings and reviews. I truly do read and appreciate every one. Remember, when it comes to hormones, there will always be more to discover. So follow the show so you get the next episode as soon as it's released. And if you or someone you care about needs a caring doctor to help figure out how to heal hormone problems that other doctors have dismissed, check out my website at www.danagibbsmd.com. And if you're not a physician, please keep in mind, while I'm a doctor, I'm not your doctor. The content of this podcast is my opinion, and it's for educational and entertainment purposes only. This is not meant to be individual medical advice, and you should consult your own physician for any medical issues or diagnoses that you may have. I look forward to continuing this journey with you beyond the thyroid.